The NAP4 project, in my opinion, was probably one of, certainly in the UK, the most important airway project ever undertaken. Dr. Tim Cook, Dr. Nick Woodall and Dr. Chris Firk did an amazing job in being able to collate a whole country's airway problems and quantify what those problems were and break down all the different elements. So in terms of supraglottic airways, in the UK, of the almost 3 million general anaesthetics that we provide, over half, I think it's figures about 56% or so, are supraglottic airway devices are used as the airway management device, and it turns out in the UK that about 90% of those are first generation devices and about 10% are second generation devices. Many of the problems that were encountered, and remember these are serious problems sometimes, these are aspiration problems, there were unfortunately deaths, there was brain damage, there was emergency surgical airways that were required. So these serious complications and these serious problems were related to supraglottic airways, and many of those were related to perhaps inadequate experience or inadequate uses of first-generation devices. And I think one of the messages that comes through, I think, quite strongly from the NAP4 report is that there's a range of patients, that there are young, fit, healthy patients who have no airway problems, who have no aspiration risk, and in which first-generation devices are, of course, perfectly useful. But also that there are patients who have greater risks. There are patients who might have a slightly increased risk of aspiration. They may have patients who are maybe overweight. There may be patients who have other problems. And perhaps for those patients, we should be using supraglottic airways that have superior profiles, such as the second generation devices. And I think that's an important message. I don't think we're there yet, and I think most people, most anaesthetists, will tend to use first generation devices because that's often what they're very comfortable with. But I think there's an educational role here, and I think the NAP4 has been extremely important in that respect.